Now, more Kenyans are having fewer children than they did 30 years ago. The Kenya Demographic Health Survey of 2022 indicates that on average, a Kenyan couple will have 3 children, down from 7 in 1989. The data also shows that the number of women-headed households has grown significantly.
The face and size of the Kenyan family has been changing. The Kenya Demographic Health Survey of 2022 shows that the size of the average family has been steadily shrinking. A nuclear family in Kenya is now likely to comprise of 4 people. The same data also shows that the fertility rate in the country continues to decline. A woman in Kenya is likely to have just 2 children, with that fertility rate now at 3.4%, down from 6.7% 30 years ago. However, that decline is not reflected in counties in the marginalized areas like Mandera, where the fertility rate is highest in the country at 7.6%, West Pokot 6.9%, and Wajir and Marsabit 6.8% and 6.3% respectively. Nairobi has the lowest fertility rate of 2.6%, with Nyamira and Machakos a close second and third with 2.7% and 2.8% respectively. The survey attributes this change in the success of the family planning campaigns that have seen 63% of married women using any method of family planning. The data also indicates that the family setup is also changing, with the percentage of men and women-led households now nearly matching up. Women-led households have increased from 32% in 2014 to 34% in 2022, while 40% of households in the country are led by men. While the survey indicates that strides have been made in the reduction of cases of gender-based violence, it also indicates that more women than men find it justifiable for men to beat women for any number of reasons, including if the wife burns food, argues with the husband, refuses to cook, goes out without permission, neglects the children, or refuses to have sex. The survey also shows that the country is on the right track as far as advancing the health of mothers and infants is concerned, with both maternal and infant mortality rates declining. Cases of wasting and stunting in the growth of children have also declined significantly.
We are proud as a country that the proportion of live births that are assisted by skilled providers of health has increased markedly over the past 2 decades, from 41% in 2003 to 89% in 2022.
The survey shows that the country's health insurance cover is still below par, with only 26% of the country's population covered.
This data has provided a good background for reforms at the National Hospital Insurance Fund as we structure how best to implement universal health coverage through primary healthcare networks. Actually, Professor Ndungu, now I have the confidence to stand and say I must clean up NHIF.
The Kenya National Bureau of Statistics carried out the survey from February to July 2022, interviewing 42,300 households. The results will inform government plans in different sectors. Brenda Wanga, Citizen TV, Nairobi.
Vehicle